That's perfect.
Hey, JD.
All right.
Thank you. Okay, thank you very much.
Clerk will call the roll.
Glenn Whitley, County Judge.
Here.
Rory Charles Brooks, Commissioner Precinct 1.
Present.
Devin Allen, Commissioner Precinct 2.
Here.
Gary Fickes, Commissioner Precinct 3.
Here.
J.D. Johnson, Commissioner Precinct 4.
Here.
Constitutes a quorum.
Thank you. Our invocation today will be delivered by Pastor Reggie Scott from Fielder Church in Arlington. Thank you so much for coming out today. After the invocation, please remain standing for our pledges.
Let's go to the Father in prayer. Good morning, Lord. This is the day that you have made. May our hearts rejoice and be glad in it. All that you do is good. All that you do is perfect. Thank you so much for allowing us to open our eyes and see the faces of our loved ones. God, we ask in Jesus' name that you would give wisdom to Judge Whitley, the commissioners, and all this that are in this room as they listen, discuss, and agree. God, if there's any that have concerns, I pray that there will be honor and respect in addressing those concerns. We just ask in Jesus' name that there will be a peace and a sweet spirit in this room, camaraderie, honor, respect, and appreciation for each other. We ask all these things in Jesus' name. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible. Thank you, Reverend. Appreciate it. Thank you, Pastor Scott. We appreciate you. Mr. Manius.
Thank you, Honor. Members of the Court, we have several announcements as it relates to the agenda this morning. The first one, we have some revised court communications that are in your red folder. We should have sent them out to you electronically also. That would be under the Administrator section, item 8A1. You should have received the full deck of information that we're going to present. I would like to point out one item on that particular agenda section is that in addition to the discussions that we're going to have as far as our programs and the coronavirus and the influenza, Ms. Tidwell, our county auditor, is also going to make a presentation to you as it relates to leave activity that she would like to brief each of you on. Also under the Administrator section, item A2, this is the resolution for the extension of the DSREP program, and we do have a position for you on that, and we're going to ask you to approve a policy decision or policy issue when we get to that particular item. If we could go now to Human Resources, this would be item 8D5. This is concerning a double fill in a position for Constable Precinct 2. We're going to hold that for 1 week and then we'll bring that back to you. And then finally, members of the court, as part of our briefings on COVID, Mr. Tanasia has his slide deck also that we provided to you, and he'll be making his presentation at the very beginning of the agenda as we have in the last couple of weeks. Your Honor, we do have two audience participation forms, one that deals with item 1 under the Administrator section, and the other one is a non-agendized particular item. So when we get to that, to those sections, just remind you that we have those two.
Okay.
Thank you.
Thank you, sir. Court members, you have before you the minutes of a regular meeting of April the 20th.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Fickes, you need to hit your light. Commissioner Johnson.
Yes.
Motion passes unanimously. We have a proclamation today. Commissioner Allen, Commissioner Fickus, I think y'all are taking that under consideration.
Yes, we did co-sponsor that. I think we have a number of folks who have joined us today. Commissioner Fix, did you want to read it, or would you like for me to?
Go ahead. Go ahead.
So this is in recognition of National Therapy Animal Day. And whereas Pet Partners serves as the nation's most diverse and respected nonprofit, registering handlers of multiple species of animals as volunteer teams, with thousands of therapy animal teams serving in communities across the United States. Whereas Pet Partners has designated April 30th of each year as National Therapy Animal Day, and whereas many of these animals have become more than just pets because of their intelligence and loyalty, and they serve as guardians and companions to people with a wide variety of illnesses and disabilities. And whereas Pet Partners Therapy Animal Teams help improve human health and well-being through the power of human-animal bonds. And whereas these remarkable pets with amazing qualities and their human companions work with vulnerable populations to bring comfort and healing to those who need it most. Whereas Pet Partners Therapy Animal Teams make millions of visits each year in settings such as hospitals, nursing homes, schools, and hospice to help patients in recovery, those living with Alzheimer's, veterans with PTSD, and those who have experienced crisis events, to name a few. And whereas therapy animals are not just your typical best friend, these incredible animals are trained to love and assist, and they do that and so much more. And whereas National Therapy Animal Day is a day to show appreciation for these animals and for the positive impact they have on human health and healing. Now therefore be resolved that we, the Commissioners Court of Tarrant County, do hereby proclaim April 30th, 2021 as National Therapy Animal Day, and encourage our citizens to celebrate our therapy animals and their human handlers. In witness whereof, we have hereunto set our hands and caused the seal of Tarrant County to be affixed this 27th day of April, 2021, and with that, I move for approval.
Second.
We have a motion and a second. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Yeah, so joining us here today are Jaquetta and Russ Rivard, hopefully I pronounced your names correctly, and Jaquetta's English Cream Golden named Keely. And then second is Lynn and her Golden Retriever Jake. And then of course we have Brady from our District Attorney's Office. So if you all will join us here at the podium.
And I want to thank y'all for working with our staffs and staffs to do this today. And I want to thank Sharon. Where's Sharon? Thank you, and all you in your office with Brady, all the great things that y'all been accomplishing. And so we really do appreciate all this. So let me bring mine.
Y'all come on down. Come on, Keely.
I'm ready.
We go.
No, just come right here and turn around. We're gonna take a photo.
Come on, Sharon, get in here. Get Brady in here.
I think they.
Need a fight.
Yeah, they like each other.
I'm gonna give you that.
You're gonna need to get. Sit down now.
Sneak in there, Sharon. Sharon, get in there.
Bring my 3 pet tickets.
Don't bring the horse.
So my staff wants a therapy dog for
Yes.
the administrator's office, and I said we're going to get a pit bull.
No. Pit bulls are loving dogs.
Until they bite you.
The bigger question is, why do they need a therapy dog down there?
Really?
I have no idea.
I'm making a motion.
A leadership issue.
I'm making a motion. Who's second?
It is not on the agenda.
Okay, next before us is the consent agenda, and I've got one question. I don't know if I just need to pull it off or just ask the question. On H8H2, approval of property tax waivers of penalty and interest. There's something in the back of my mind that says we're not supposed to be able to legally do that, so
Which one is it? Your Honor?
8H2.
Under tax assessor collector.
I thought we were, I don't know if you've got any, but I always thought that we couldn't waive penalty and interest.
I believe we can in certain situations.
Commissioners, in certain instances, the Commissioners Court is the only governing body that can waive penalties and interest, and it is only for certain reasons. There are 3 statutes in the state of Texas that those waivers can be accomplished, and we have vetted these out, but you are the only governing body that can approve those waivers.
And so we've gone over this with the attorney, and she agrees that that's something we can do. Under the particular things.
Who's the, do you know which attorney you dealt with in the DA's office on this?
Steve Lund is our DA. But
Okay.
we only do waivers, we present them to you, and these waivers are if the post office loses some, if we don't get it out timely, if there is a situation that is out of the control of our office, they can be waived. There are only 3 instances on the books that they can be waived, and you are the only governing body that can approve them. I'll let Chris speak.
And Judge, that's something I honestly see here before you. I'm not quite sure. I have no reason to disagree with Ms. Burgess. That may in fact be true. I haven't had an opportunity to visit with Steve Lund from our office. From my perspective, I would prefer to wait a week just so that I can double check that, make sure that's fine, and unless I can get Mr. Lund to provide some communication before the end of this meeting.
Why don't we do this? Why don't we can just delay action on that, and then we'll come back and you can speak with.
So I'll just ask that we pull item 8H2 off the consent agenda, and we'll address that maybe
At the conclusion.
at the conclusion of the meeting.
Yeah.
Thank you.
So with that action in mind, I move for approval of the consent agenda.
Second.
We have a motion, a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. And Wendy, I apologize. I had looked at this and I forgot I was going to contact somebody about it, and I just,
I'm gonna go grab my code book so I can read to you from the code, and that way you're.
great, thank you.
Yes, sir.
Okay, Mr. Manius.
Your Honor, we have one audience participation as it deals with item number 1. Would you like to do that now? That is an in-person audience participation from.
Well, since both of the folks that are wanting to do the audience participations are here, I think I'm going to do both of them.
Okay, very good.
And what I'll do is I'll do the one that is not on the agenda to begin with, and then follow that up by the one that is dealing with the COVID and the masks. So my first audience participation is Benson Varghese. I'm sure I've mispronounced that. I apologize. Good morning, sir.
Good morning, Judge. Good morning, Commissioners.
If you would please state your name and your address, and then 3 minutes. Because it's not an item on the agenda, we're precluded from responding at this time.
Yes, sir. Thank you. My name is Benson Varghese. My address is 300 Throckmorton, Suite 1650, Fort Worth, Texas, 76102. I am here as currently the president of the Tarrant County Defense Lawyers Association. I'm also precinct chair in...
You can take the mask off if you would like to while you're speaking.
Thank you, sir. In 4634, and I suppose for today's purposes, my most important title is simply a citizen of Tarrant County. Before I address a resolution that the Tarrant County Defense Lawyers Association has passed, I'd like to give you some background. Last month, a Tarrant County District Court judge found that Dr. Pirwani gave false and misleading testimony in a 2006 capital murder case for which the accused was sent to death row and currently remains on death row. 10 matters that are material to the outcome of the case. Based on how I have approached the court, I realize that I may not be able to submit the materials I've prepared today. I have them prepared and I can provide them to the court at a later date. But every item is cited to the court's opinion finding Dr. Pirwani's testimony was false and misleading. Again, in the most critical type of case, someone is sitting on death row for this. It goes to the cause of death that Dr. Pirwani testified to. It also goes to materials that Dr. Pirwani withheld from anyone, the defense and the prosecution, and none of this came to light until a second writ hearing after multiple appeal processes were exhausted. I'll speak quickly. I realize I only have a minute left. We are asking for the court to conduct an investigation into Dr. Pirwani's administration as the medical examiner. We're calling for the court to consider whether or not he should remain the medical examiner, and a retirement/resignation is not sufficient. The investigation must go on based on the nature of the violations that he's committed. Additionally, the issues regarding Dr. Krause are all part of the public record. We're asking for an investigation into Dr. Krause as well. I realize you can't respond. I would like to submit some materials. Part of the reason I haven't submitted them in advance is they contain autopsy records and a lot of private information, so I'd like to find a way to submit that material perhaps under seal, but my resolution I can submit in its entirety. But I'm on behalf of the citizens of Tarrant County asking for the investigation into both, perhaps using the Texas Rangers, expanding the role of Dallas DA Judge Cruzo.
Okay, I'm going to ask our district attorney one question. Is there any way that if he provides any information to Mr. Manius to pass out to us, is there any way that that can be protected from public information requests?
No. Depends on what's in it, Your Honor.
Well, I mean, things can be redacted, subject to an open record, but when they're procedure in open court, what is your thoughts?
Yes, I different resolution. I mean, that's something I can look into further, Judge, but I think we have to assume anything that's going to be held, handed out here, we're not able to redact any of the information that you're able to under the Open Meetings, obviously the Open Records Act, that it will be public.
So I asked that question solely for you then to determine whether or not you want to provide that information to us, because once you do, I feel like it is going to be subject to open records request.
If I may ask one question, Your Honor.
Okay.
Judge. I'm happy to provide everything other than the autopsy records today if there's a mechanism for me to provide it to the court staff.
If you will provide that to Mr. Manius,
Yes, sir.
then whatever you provide to him, he will pass out to us. And ultimately, then, as we've just discussed, more likely than not, it will be subject to public information requests.
Yes, sir. Thank you.
Thank you. Our next individual who wishes to speak is Blanca Martinez. Good morning.
Good morning. How are you? Thank you for having us and having the open mic and the building open. We know in Dallas it's closed, and that's just a little bit of the dynamics involved in this pandemic. I have a handout here for you guys.
Mr. Manius.
Would you like to take this for them? This is on an article that was featured as a Jew. Sharaf was required to wear the yellow Star of David on her clothing at all times so that she could be identified, segregated, and discriminated against. By law, Jews were not allowed to engage in society like other Germans. They were barred from ordinary activities, including educational, religious, and cultural gatherings. Their private property was impounded and they were forbidden to travel. These painful memories from my childhood sensitized me to the threat posed by current restrictive government dictates. She says in 1776, Benjamin Rush, a doctor and a signer of the Declaration of Independence, foresaw the danger of medicine organizing as what he called an undercover dictatorship. Under the Nazi regime, moral norms were systematically obliterated. The medical profession and institutions were radically transformed. Academic science, the military, industry, and clinical medicine were tightly interwoven. Not much different from what's going on today with those that are not vaccinating, being called super spreaders. Being in a time where this pandemic, this vaccine has not been tested. It is an experimental vaccine with fetal material in it. It's unconscionable that we are promoting a vaccine that it's an experimental where every single animal died in the preliminary experiments. We must ask God for the strength and the courage to stand against this Nazism, this evil in our country and in our nation. And I'm not angry at you. I'm angry at the devil for how he has blinded the minds of those which cannot see it. How are they blinded? They're blinded because the censorship that's going on. They're prevented from hearing the truth because the elite have bought out the media. They bought out the TV, and all the hundreds and thousands of doctors that speak up against it are censored. They're called fanatics. They're called all kinds of names because they're trying to degrade those of us that are thinking still, those of us that can see there's something wrong with us. The same thing as they did with the Jews. We have to go in the back room. We can't be in the same courtroom with everybody else because we refuse to wear a mask, or we're medically not able to wear a mask. When all of the evidence shows that mask does not help, in fact, it hurts. There are some websites here that I would like to, okay. Yeah. There's some websites here that I would like for you to go and please, I beg you to go at least see if what I'm saying may be correct. Daystar.com, You can go in there and look up vaccines, and they will give you all of the current information.
Thank you, Blanca. We'll look at that.
Okay, thank you.
very
God
much.
bless you.
Judge, let me just say that I am not Jewish, but I resent having the horrors of the Holocaust used as a club because somebody doesn't like a vaccine. That is cynical to the utmost and just entirely inappropriate, and I resent it, and I could not sit here and stay quiet and let that pass. So you may go ahead.
I guess one of the questions that I would ask, if any, it's my understanding that at least the Moderna and the Pfizer vaccines were not produced with any animal-related or virus-related type of...
That is correct, Your Honor. The Moderna and Pfizer are both mRNA vaccines, and they're lab-generated, so they weren't utilizing any animals or, any of the fetal material that she talked about.
Mr. Martinez.
Thank you, Your Honor. Members of the Court, we can now go to item 1 under the Administrator section. I'm going to ask Ms. South to come forward and begin the discussion.
Good morning.
Good morning.
Morning.
Should be fairly brief today. There are not a significant amount of changes from the last time. So we'll move right into the pillar slide this morning. We'll touch on the testing site locations. Currently, there are still 3 permanent testing locations. However, JP Elder will most likely be the next location to shut down just due to the low numbers at that specific site. If or when that happens, Jessica Mason with our Emergency Management Department will send out an email with that information, and then we'll follow up the next week in court. Under the social services pillar, the ERAP program is underway and has had a great response. Kristen's been doing an excellent job with her team. In the first 4 weeks of the program, the county has sent out $230,886 in payments to 36 households. That number continues to climb weekly with paid outreach beginning next week with Belmont running that campaign. A quick note on the Texas Eviction Diversion program that's under the social services pillar. That did receive a total of 68 court referrals in the 2-month span that it ran. However, recent changes at the state level have basically made that program difficult to administer. So moving forward, court referrals will be routed through the ERAP program. So we'll continue to report on that number. It'll just be through the other program.
Very good.
Yeah.
Moving on to the vaccination update. As you can see from the numbers on the slide, even though the J&J is still paused, the number of vaccinations completed by Public Health and its partner entities continues to increase. UNT Health Science Center, in partnership with the county, did open the Ridgemar Mall site last Wednesday. It is located inside of the mall at the old H&M Shopping Center. And I know last week, I don't remember who asked, but there was a question about signage, Commissioner Brooks. And we did speak with UNT. They have advised that they've ordered new signage. It wasn't in their original package that they had put together. But they ordered specifically new signs for this location that'll be placed outside in the parking lot and then indoors on the ground level, directing them upstairs to the old H&M location. Also, a quick note, once that location was announced, the employees at the mall started receiving phone calls from constituents. So UNT reached out to the employees, and they have provided them with all the information they could possibly need to answer questions from anyone that calls about that site location. And then, as UNT mentioned last week during their presentation, they have targeted a new site at UT Arlington. I believe that that's scheduled to open the first part of May. And next week when they're here to present, I'm sure that they'll talk a little bit more in detail about that site. The county still continues to take direct appointments. We have been working with UNT to simplify the registration process, make sure it's as easy as possible for people to go to the website, via whatever location they have and get registered. So if you visit the TarrantCountyStrong.com, you can view the 8 different locations that are listed out there. It's very easy to navigate. It includes a map for directions along with the address of the site, the times the location is open. You can click the register and select your date and time slot at that very time. We'll continue to look at the website and evaluate things to ensure that it's easy and as easy to navigate as possible. Next is our call center data broken down by zip code. The call center continues to receive heavy call volume, receiving approximately 17,000 calls, with about 1,400 of those being for registration or appointment requests. 76137 is listed as the #1 zip code for the week of the 12th through the 18th, and that is a site that has been identified as a hard-to-reach area. So we are working with UNT to locate more of these locations, and seeing that kind of data is encouraging to us. There is one typo that I wanted to point out on the 3rd slot. That should be 75052, not 75051. And we'll make that correction and send out the revised map after court. There's no significant changes on the county grant update slide. And then, as we discussed last week, we're going to begin breaking out the notice of funding related to the county grants. So this is what you'll see week to week. Hopefully it'll make it a little easier to see what funds are anticipated to be awarded and accepted. So this is where you'll see the FEMA information until the project worksheets are approved and the notice of award has been received and accepted in court. The DSHS vaccination project for public health for the $12.3 million is being presented in court for approval today and will show up on the overall grant update slide next week. Last is the county spend update, and there aren't any significant changes to this. And that's all I have. I'll be happy to answer any questions you may have.
Stay where you're at.
Sorry about that, Megan.
You're fine.
I missed what you said after the updates about the grants, so if you wouldn't mind repeating yourself.
So this is just the slide that we had talked about last week, just pulling out the notice of funding, just so it's a little bit easier to see what funds are anticipated and being awarded in court. And so we'll see our FEMA information on the slide moving forward until the project worksheets are approved and the notice of award has been received and approved in court. I did just want to point out that that DSHS vaccination project for public health for the $12.3 million that's listed up there is being presented in court for approval today. So that'll show up on our overall grant update slide next week. And then there weren't any significant changes to the county spend update slide. And that's all that I have for today.
I do have a question about these grants.
Okay.
I mean, that essentially is just going into our larger pool of resources to implement COVID mitigation efforts, but is there anything more that we need to be talking about the best use of these dollars? I don't want to just assume that, it just all goes in the same bucket and we're good.
I don't know.
A lot of the grants that and we'll ask Vinny to address that, but a lot of the grants that public health gets they're one of two types. One, they're very specific in nature in what you can spend the money for, and it deals with directed, targeted programs like COVID issues. And then there are some that are more general in nature to strengthen the ability of public health to respond to future pandemics. And so we have a variety of those. I don't know what the $12 million is for, but it's going to fall into one of those categories. I know that didn't answer your question, but those are the two broad categories you're always going to see. And there's a significant amount of money that's coming down into the public health department, and you'll see them in either one of those two silos. So,
and actually, Mr. Manish described it perfectly. And just to kind of give you a preview, this $12 million, it had choice of 3 deliverables, and we didn't have to pick all 3. We picked 2. One is to increase vaccine capacity all across public health. And the focus is obviously COVID vaccine, but they understand because of COVID, other vaccine clinics are suffering as well because all our staff are busy with this. So it's to improve vaccination capacity for public health. And the second deliverable we picked was actually to engage other providers, recruit them, train them, monitor their activity related to COVID vaccines. So that's kind of the two deliverables that we picked under the grant.
Thank you.
Any other questions? Thank you.
So, Your Honor, we do have another speaker on this particular topic. Would you prefer to listen to or hear that person now, or would you like Mr. Signage to make his presentation?
No, I think I'd prefer to go ahead and have the speaker come forward. I believe it's Dora Tovar.
Good morning, Your Honor, Commissioners. I'm here. I'll try to keep it to 3 minutes, but I have prepared comments, and I'll try to read quickly in case you have questions. Good morning. I'm here today to speak about the current COVID registration, the registration confirmation, and the lack of service provided to limited English residents, and the discrimination that non-English speaking minorities face in your current vaccination administration. I'm going to share with you my experience and insights from my own vaccination experience this past Saturday, April 24th, at the Hearst Conference Center as a case study. I am in my 1 hour at Hearst Center. I had to translate for 12 individuals and take one non-English speaker home to Grapevine because of the debacle of an experience that I will now relate. On Thursday, April 22nd, I called to reschedule my missed second vaccination appointment because of the long wait and because I was doing so while driving with my headset. I chose to use the Spanish language option. When the call was answered, I was pleasantly surprised to hear the voice of a Mexican origin voice, which is critical because Texas and Tarrant County is 89% Mexican. After speaking with her in Spanish about my new appointment, she told me I would receive a confirmation of my appointment following the call. I asked her where her call center was located, and she told me she wasn't authorized to tell me, but could tell me that she was in Texas. At this point, my confidence was high. That couldn't have been further from the truth. In fact, this call process is the only part of the experience that is implemented well. Shortly after my call, I received a text message in English. At the time, I didn't think much of this because, of course, I'm English dominant, but Spanish preferred. I confirmed my appointment from the text. After the text, I received 4 calls of confirmation, all recorded messages in English. At the time, I didn't think much of this because, of course, I understand it. I confirmed my appointment and the text, and after that, as you might imagine, this is where the debacle begins. Upon arrival, there's no signage at the Hearst Center other than English at the entrance of the facility, setting the tone for the experience. The facility is set up as a drive-through facility, so individuals without vehicles have no opportunity to interface with anyone of assistance except 2 Anglo-English-only officers that are directing vehicle traffic, and even that was done poorly. I will address that later in my comments. I noticed while waiting in line that there was a Latina in her 60s wandering around the front of the facility with cell phone in hand, clearly having difficulty navigating the building to find its entrance. A voice in my head told me that I would end up engaging with her. After parking in the garage, I met a Latino family with children having difficulty finding the quickly moving attendees through the maze with no Spanish or Vietnamese signage from the parking lot to the entrance of the line. Although there were nice National Guard folks, there were very few Latino members, and they didn't make eye contact with the family ahead of me. The family had to stop. I will observe my time limits.
How much more time do you think you need?
2 minutes.
Go ahead.
Thank you. The family had to stop 3 times to ask for assistance from staff that were unable to help them other than to point the direction that they had to follow. I'm sure they were worried about their children that were accompanying them. I watched this family the entire course of their voyage. However, this was only the beginning. While in line, I had to translate and reassure 6 Spanish-speaking individuals who made eye contact with me because I was wearing my campaign shirt that alone seemed to assure Spanish speakers that I was an advocate and a friendly face to turn to for assistance. Now that the woman outside and I met again, her name is Maria, like my mom and my daughter's name. National Guardsman Barboza had momentarily stepped in to translate and guide her until this point. As a rule, we don't trust those in military training because these individuals have been deployed to the border and a well-documented factor in cultural competence training. Barboza happened to bring her next to me, 3 paces from the front of the line, and just left her there to receive dirty looks from the first 3 people in line. After experiencing discomforting looks from them, I told her in Spanish that we had all been waiting in line. She told me Barboza told her to stand there, and I said, okay. She was then assisted before everyone else by a non-Spanish speaker. Clearly, there was no process in place by the organizers as to what to do with these individuals with limited English. So the plan was to make them disruptors, put the pressure on them from the hordes of people in line, subjecting them to defending their place in the line and process. Simply unacceptable. And this is how institutional discrimination and racism begins, pitting language minorities against the majority, publicly embarrassing them and exposing them to potential conflict and harassment from those following the process, making the language minority subject to conflict for asking for constitutionally upheld and mandated services since 1965. But this is not the end. I waited to enter the facility, and an Afro-American woman escorted an Asian limited or non-English man to the front of the line, getting pushback from those at the front. I told her in front of the others, it's okay to put him at the front of the line, because he's being served in a different language. I joked with her and made the others comfortable. As I approached the front of the line, I had noticed there was a Hispanic man in front of me in line. The lieutenant asked him if it was his first or second vaccination. Then he didn't respond. The lieutenant simply repeated the question again in English without making eye contact. When he finally looked up, the man stood there silent. The lieutenant was ill-prepared to serve him. I then translated for him, and the lieutenant was grateful. The Latino gentleman thanked me and went to get his vaccine. I told the lieutenant that if he was going to be at check-in, he needed to know that if he got no response, that required him to make eye contact, to determine the look of confusion of the Hispanic man, that his role would require him to dust off his high school Spanish. I'm sure he had to get it to make it to lieutenant. He told me his Spanish was terrible, and I told him to ask primero or segundo with symbols. I was confident he could do that, and I offered to write it down for him if it would help him serve. He said he could say it. After my vaccine and waiting period, I proceeded to the garage. There in the garage, I found Maria. It turns out no one was able to tell her where to get a shuttle or that there was transportation because, of course, she received the confirmation and the transportation information in English. She told me she was looking for the Uber pickup location. Clearly, no one in the garage could help her. She was on the phone with her friend in Arlington who spoke a little English to help her in her journey since no one at the facility could help her. She told me she lived in Grapevine and that she wanted to call an Uber but didn't know how or where to tell them to pick her up. She told me a nice Spanish-speaking man had offered to take her home, but her friend in line told her that perhaps that wasn't safe, so she turned to me. I told her to go back in the center and find Private Barboza to get his help since I had to return to my campaign activities. As I left the parking garage, I decided I would stop to speak to the Hearst police officers directing traffic and advise them to look for her and please help her find a safe location to be picked up by Uber.
Now,
I'm finishing.
well past your, okay, so
I'm
you're
finishing.
finished.
And I think you should know what happens and how. Okay.
I've got the gist of where we're going with the conversation.
So after having, needless to say, I took Maria home because the officers looked at me and said, I can't help that woman. Obviously, these officers couldn't use sign language, haven't been trained to interact, and it is in Hearst where the Hispanic population is only 8% as opposed to the Tarrant County population where we're 37%. So the centers you're selecting make a difference on the demographics. Dr. Taneja, I don't know if he's received culturally competent training on how to make eye contact with language minorities, but the system is broken. And it's broken at the phone call level. And I want you to know that this affects me and my community. Because as a community leader, I have told the media that we are to send out PSAs in Spanish and encourage our community to participate in the vaccination, to get over the fear. But my experience relates an experience that happens in 1970, before we were required and really knew how to implement these language policies. The county owes my community to serve them appropriately. And we deserve culturally competent care with officers trained, every individual trained, a system for language services to be protected from harassment from the general population. We are already language vulnerable. We are already economically vulnerable. And now I'm here to tell you it is not working.
Thank you,
and that is my report. Will come back next week to hear the report, and I want to know the number of individuals who have called the call center and did not actually register and attend, because that is where the drop-off is taking place. And everyone should know that language services are important and that we as citizens and residents expect it to be implemented correctly. Thank you.
Thank you, Ms. Tovar.
Vinny.
And while Vinny is coming up, I'll just add, Ms. Tovar, obviously I know you're a Precinct 2 resident. We've talked multiple times about any number of issues, but I will want to visit with you to get some additional feedback for things that we can be working on. We've known that there are always things in this process that we can be working on. And so, yeah, we'll follow up with you. Okay, Vinny.
So I'll just make one quick comment before starting. I have been talking to our Hearst team as she was presenting, so they're going to watch this testimony and try to rectify as best they can.
Well, but it goes far beyond that.
Yes, sir.
If our call center, if they're, we've made absolutely sure that our call center was equipped to take folks who spoke a different language. And for them to then turn around and not make absolutely sure that the information that is pushed out to that individual is not in the language that they can understand, we've got to make several changes, and it's not just the Hearst Center. We've got to make sure that at each one of the centers that we have people who can assist, or if we don't have someone there that can assist, then the individuals at that center must be given a number that they can call and have someone act as the interpreter from that point forward. Because it's just not, we've got too many languages that we're trying to accommodate. We want everybody vaccinated. You and I talk about this all the time.
Yes, sir.
And so for the fact that somebody calls in and then all of the calls go back in English is not acceptable.
Yes, sir.
So we just got to figure out how to do it.
Yes, sir. At the call center level, I do want to clarify there are people that speak multiple languages, and we have the language line available.
Well, I understand
yes,
that, Vinny, but when you take
the
the language and then you send them the material back, or you call them back, and all you call them back in is English, then why do that? I mean, there's got to be some link between the call center and your people calling them back and saying, now right now they should be able to give them an appointment right there on the spot, and it shouldn't require the.
Yes.
But if we're going to send them something, we got to send it back to them in the link.
Watching this testimony right now, so we're taking notes and we'll be addressing a lot of that along the way. Yes.
And so next week, I do want you to come back here and report on what we're doing to make sure that if someone speaking Spanish calls in, that when they get a call back, they don't get a call back in English.
We understand what the request is, and we'll
Apparently, the voice-to-voice over the call center worked. But there was a step that was missed, and that was to code that individual as an other language person. That needs to happen at the intake level so that all future communications are in that preferred language.
Understood.
Simple matter.
Yeah. Thank you. All right, so let's start with our briefing here. So just for your situational awareness, I wanted to kind of point out the right half of the map is starting to turn back green. So that little uptick we saw over the last couple of weeks seems to be settling back down. So that's great news for North Texas. Tarrant County's in the same boat. We had seen a little bit of an uptick in activity, but overall I think we're settling back down. Total of 256,000 cases reported, 3,404 deaths. Hospitalizations are flat, but overall big picture trend is still down. So, we're at about 129 people in the hospital, which is 2.9% of the available capacity being used by COVID. And then 50 people in the ICU. That's just a minor tick up from the previous week, but not unexpected. And again, trauma service area E is about 3.13%, excuse me, and 484 people in the 19-county region that are in the hospital. This is the trend chart. We continue to be flat in our numbers, so it's good news. I mean, we're not going down, we're not going up, we're just kind of holding steady. The good news is actually at the bottom there, the spread rate had ticked up from 0.53 to 1.01. We are coming back down. We're at 0.91. And what that tells us is if you're below 1, the spread of the virus is slowing down in your community. And that's all we need to remember. One sort of the cutoff point. Below 1 is good news. We're slowing down. And then all these other trends confirm that information. The only thing that I'm continuing to be concerned about is the positivity rate. We're at 6%. We seem to not be wanting to go below 5%. That's been our bottom throughout the pandemic. So we're right there at the low point of where we have been. We're just kind of hovering. But everything else continues to point down or flatten out in the hospitalizations. So overall, the big picture is that we're in a downtrend and things are okay. We just need to not let our safeguards down because things can turn around. U.S. is, kind of coming off of a third or a fourth peak, if you will, third major surge, I guess. The numbers got as high, a little bit higher than what we saw in July. They were driven by mostly states like Michigan, New York, Pennsylvania. I think there were overall 13 states at some point that were starting to see huge increases. The majority of them are starting to come back down. Michigan is coming back off of a major peak. They matched or surpassed the numbers they saw in January. And then I know that overall across the country there's always some hot spots. Currently Oregon is picking up some activity, but overall when you compare to where they've been, they're low compared to where they were been, but generally their trend is currently up. But overall, big picture looks like we're stabilizing as a country and maybe turning the curve back down at the national level. So what should we continue to do? We need to continue to wear our masks, maintain our 6-foot distance, and avoid large social gatherings, and then of course continue to wash our hands throughout the day. We're waiting to see, apparently there's new guidance coming out from the CDC about masks, and the expectation is that they might have this dichotomy, if you're vaccinated, what can you do? If you're not vaccinated, what can you do? That's been the trend that's been followed in several of their recent guidance. So we'll see what comes out. I think they're supposed to announce today. Talking about announcements, there was also the announcement that, the ACIP, the Advisory Committee of Immunization Practices met. They recommended to the CDC that the Johnson & Johnson vaccine could be resumed. CDC and the FDA met and then issued guidance that they're okay unpausing the use of Johnson & Johnson vaccine. They have issued revised documentation that shows this additional side effect. Rare occurrence, I think out of the millions of doses given total, they found about 15 or so cases that people can get a blood clot with it. But, they updated the guidance with it saying, okay, it comes with now a warning, just like many other medications do, that if you use this medication, there is a chance of a side effect. So with that, the vaccine use has been unpaused, and Johnson & Johnson is again available. to use across the country. So here's the update on the clinic schedules. We have, declining vaccine interest. So as a result, there's some sites that we were running at full speed. There's not enough appointments there to keep those open. So this week, we have Bob Boland facility, the public safety complex in Fort Worth, operational only on Monday. The rest of the week, they're closed. Now, Fort Worth is usually trying to do some ad hoc type events. So they may come back and do a small event there at the Bob Boland, but currently on the schedule, they're closed for the remainder of the week. Similarly, at Resource Connection, they're open Monday, Tuesday, and Wednesday, and there was not enough appointment activity to warrant Thursday and Friday being open. We're keeping our options open. If traffic interest builds up, we'll certainly bring back the site, but right now it looks like we can absorb and handle most of the appointments through our other sites. The last I looked, we had 11,000 capacity available, and I don't think there's that much interest to get new appointments. So we're okay on capacity.
I object to your shutting down the Resource Connection site. It is one that is strategically located for communities of color, which is the population that is hardest to reach. There are some efforts that Commissioner Allen and I will be beginning to roll out that may make that the traffic at that center a whole lot better. I just prefer that you not close it and give us a chance to fill it up. It's better, it's easier to leave it open and let the volume find it than it is to close it, have us generate some volume, and then try to reopen it. That just doesn't make any sense to me.
So you're not talking about closing Resource forever? You're saying limit
Just
the
this
number,
week, yes, sir.
Limit the number of days. Are you saying you're going to close it this week?
So there's 3 days that are open and 2 days there's not, because there was no appointments. So we currently have capacity on all 3 days. Of course, Monday's gone and Tuesday's on. But if there is interest of people getting vaccinated, we have plenty of capacity. We're almost at half capacity at Resource Connection. So if you find us 2,000-3,000 people, we can take them in now without even having to open another day. And those days, what we're using for, Commissioner, is actually bringing back services to our other vaccine clinics, because there's just limited number of staff, and we're trying to find that balance. Okay, take some folks, go do some other services. And there's conversations happening within our team that we're going to start adding COVID vaccine at those clinic sites. So if we, close one site for 2 days or so, we might be able to bring back services at other sites. So it kind of spreads out. There's a lot that goes on in the back, but I agree with you. I mean, if we can find the volume, we'll be happy to keep that site open and keep it going. I just don't want them sitting there and not have people coming.
My problem is closing a site that is easily accessible and favoring sites that are less accessible. If you've got to close something that is not as easy to get to as Resource Connection.
But so what you're saying, Vinny, is we're just simply flexing, right? But so we're not closing Resource Connection,
No.
but we're just flexing for the time being because of the current demand.
Correct. Due to current demand, we're limiting our schedule, not have assets there idling. That's what we're trying to do. Yes, that is correct. So, again, quick update on where we are.
So let's go. I want to ask a couple other questions on the vaccines. Ridgemar has been open now how long?
I think this is their second week, I believe.
Are we seeing
Since
any?
last Wednesday.
Are we seeing any increase in activity subsequent to 5 p.m. for people that may be off of work, or because every one of these that you've got here are basically during work hours? I mean, I know you've got some Saturday involvement there, but it's difficult to ask someone to take off work if we've got this, have we tried or could we try some, 6 to 9 or something along that lines that would allow people who work to be able to come and to get the vaccine?
Yes, sir. I will double check on that information with our team who's running the Ridgemar site, UNTHSC team, to see what the traffic patterns have been like after 5 p.m. And we'll, replicate the model if there's enough volume in the evenings. We're happy to do that. In fact, the grant that I will present to you, part of that thing is that you will have enough staffing and capacity to run clinics, on the weekend, later in the evenings, and so forth.
It's also my understanding that that there is a couple of vaccine finders, but one at least that allows you not only to select from our locations, but also from all of the drugstores that may be providing that. And so we've probably got a whole lot of folks, because there's probably 30 or at least 30 or 40 pharmacies, local pharmacies that are now have some actual vaccines. And I was talking with someone the other day who said at Walmart, maybe than you.
Yes, it was.
So it was somebody that said they were going around the Walmart store and just basically seeking out people. So, we may very well be getting very close to the point to where people could go in stores and be able to get that. That was ultimately what our goal was, but I think we're still maybe a month away from saying, okay, we should turn this over to the pharmacies and let the pharmacies or other private sector folks take this over.
Yes, sir. And you brought up a good website. So we did launch something, I think last week we talked about it. It's tarrantcounty.com/vaccine finder. So on the top of the page, easy to find maps and addresses for all the publicly run sites that we're involved in or partnered with. And when you click on the Register Now button, it actually takes you to the appropriate site. So the site's run by Tarrant County Public Health. They take you to our COVID shot page for sign up. But the ones that are run by UNTHSC, it goes to their Optum website. And if there's another partner entity that plugs and plays, it can go right. So it's seamless to the customer, so to speak. It takes them to the right page. And at the bottom of that, there's a DSHS map. It's statewide, but you can zoom in on the DFW area and find vaccine at private providers, pharmacies, variety of other locations. It's maintained and updated by DSHS, and it's embedded on our page as additional options. So if none of the other sites that we're operating with works for you or the time's not convenient, then you have the choice to go look at those other sites and book an appointment from there. So that vaccine finder site, I think, is very useful for the public and kind of addresses what the judge was trying to say about convenience of hours and days and locations. There's plenty of choices now for vaccination in our community.
I will say, yes, I agree, there are plenty of choices. However, when I went to that website and looked at the list, it was glaringly obvious that there were not any in Southeast Tarrant County, which I know that UNT continues to work on this, the possible site at UTA. I know we are, somewhat thrown off the schedule because of the initial site not working out, but just when UNT comes to give an update next week, I expect a date that we're going to be open. If it's not UTA, it needs to be somewhere else, because at this point now, between when the FEMA site closed and early May, then that's almost a month. I think if I'm counting the weeks correctly. But additionally, I want to make sure that I understand this is more to UGK, is from the date that we began implementing our contract with UNT to some, very near point up to this week, is what are the numbers? Who have we been serving by way of this contract and partnership? Thank you, Vinny.
I think I have some of that data too, Mr. Maney, so I'll try to pull that together for you. Okay. So going back to the dashboard, as always, I want to point out the data is already getting old. This is from last Wednesday, but we had crossed over 1 million doses given, and about 543,000 first doses. That's about 26% of the county, and 356,000 second doses. That's 17% of the county. Now, what I have also noticed is that there's a Dshs Dashboard, and they update on a daily basis. Unfortunately, we don't get to download that data on a daily basis, So their numbers are definitely ahead of us now, showing for Tarrant County. So I have my team working with the DSHS to see what's the discrepancy, what can we, get the data, more current, and hopefully we can, close the gap. But we're doing okay as a county. We just can't afford this fall off in interest. And that's my message to everybody who may listen, that we can't, not vaccinate. The time is now to get vaccinated when the cases are low. And the point I was trying to make is that Michigan saw a huge surge happen, even though they were vaccinating as fast as we were. So it can happen anywhere. And we have a lot of people that are still vulnerable and not protected against COVID. So we need to continue our vaccination efforts, and everybody needs to participate. So here's just an update on where the signups are happening. As you can see, efforts made by a variety of entities, including you all, are paying off. Several areas that were lighter shades are now darker shades because people have signed up. But you can still see pockets in our community that are just slow to uptake and slow to sign up. And that's where the resources and efforts need to be concentrated so we can get everybody vaccinated in Tarrant County. And then here's just a quick update on the race ethnic breakdown and the age groups and so forth. Again, slow but continuous improvements happening in every category. Some of the data is going to remain unreported because it's collected from a variety of partners, and some of that information originally was not required and later DSHS made required. But till then, there was a lot of unreported areas, and it's just going to stay that way. And then here's a final chart on the summary of all that has been done with us, or Arlington, and then some clinical partners like THR, Village Statewide, and JCS involved. So overall, we believe that this is what we know within our local data, and then the dashboard actually takes everything that DSHS provides and puts it all together. That's all I have.
Vinny, you mentioned that Dshs now is reporting daily, but I know at some previous point there was a lack of confidence in that data. So give me an update on that.
So we're still going back and forth with them about data accuracy. That literally on the way in, I was having a call with our dashboard team. So the file that we received that is going to be updated on the dashboard tomorrow, it's already in today and they're analyzing it, but we're probably in our data going to add maybe 70,000 doses total. But the delta between what they're showing on their dashboard and us is now over like 150,000. So I asked them to call and find out what's the difference. Are there things that we are not getting in our data set? Because somebody's running a report and giving us a file, and then their dashboard is directly connected to MTRAC. So is there anything missing? So we'll continue to work on it. Our dashboard will have a note saying that we're in the continuous process of reconciling with DSHS. But we're limited by what they provide us.
Understood. Thank you.
All right. Thank you.
Okay, members of the court, we're now at the introduction of the court meeting. I stated that the auditor was going to make a presentation, and Ms. Tidwell is here to address the court at this time. If you look at information was provided to you, I believe in your red folder. It's the last 2 pages of, and you may have this electronically, but it's the last 2 pages to the attachment on item number 1.
At the top, it will reference the American Rescue Plan, 2021 American Rescue Plan. And I'm going to talk primarily about the first page, the recommendation. The second page is just some additional information. This time last
I'm sorry,
year.
Renee, will you hold 1 second? I'm trying to find that.
Okay.
Where did you say it was again, Chico?
Okay, so did you receive the
Oh, it's in the big packet. Okay, gotcha.
Yes, ma'am. Last 2 pages.
Okay, got it. Thank you. Okay.
Ready? Okay.
Well, you talk fast, Renee, so I want to make sure I'm ready to go.
I'm sorry.
No, you're fine.
So this time last year, we were talking about implementing the mandatory family medical leave provisions that were included under the CARES-related legislation. And those provisions were mandatory throughout last year through December. In December then, when that ended, the county implemented its own pandemic leave for employees, which we still have. In the American Rescue Plan Act, there is a specific provision for extension and broadening of family medical leave that could be offered Participation is no longer mandatory. It is strictly voluntary. Previously, again last year, the county was not allowed any credits for any of the leave. And a credit, the way it would work, is if I was out on pandemic leave and you paid my dollar salary, then when I filled out the county's 941 to pay our payroll taxes, the county could be eligible for that dollar to offset a tax that we would have to pay. So last year we didn't get to participate in the credits. It was only private sector. Since this is voluntary now, they're also offering an opportunity for the county to participate in the credits.
So let me ask a
Go
quick
ahead.
question, just because maybe this is a clarifying. So let's say, for example, that while you were out, I paid you $100. And on top of that, we withheld your FICA and we withheld your Social Security from your check, and then we matched that when we filed our quarterly report. What we're saying is it the $100 that I paid you will go against the cumulative amount of matching FICA that I have to pay every time we do a payroll?
So I'm not in the weeds on this, but my understanding at the high level is if you paid me $100 in wages, and it was for pandemic leave, not anything else, then the county could take a $100 credit that would offset, yes, it's matching FICA and or Medicare.
So this is a big amount of money.
Well, that's.
Or could be.
Could be.
Could be.
So if I went ahead and addressed that, part of what would determine whether this is advantageous to the county is the size of the dollar amounts and tracking actual usage at the county of pandemic leave. The last two payrolls, we've come up with the monthly average that's referenced there of $38,000 just for wages, just for simplicity. Okay, so there would be some FICA and some other costs possibly. There's a lot of cost to implementing this because if we implement it, we have to implement all of the provisions across the board. We don't get to pick and choose. And then we have to reprogram payroll and do a lot of other administrative work to set these back up. People have to be paid at what's called the regular rate of pay, which isn't just their hourly wage. It includes vacation and or shift diff or other kinds of things. So it's a complicated calculation that we struggled with last year. There's a number of things that I've addressed here that could be issues. Even if we're paying a grant-funded employee, we can't double dip. So we couldn't take a credit for that $100 of salary that we paid the grant-funded employee and yet still charge the grant for the $100 of wages. So there's a lot of adjustments in the bookkeeping. We could actually then, in some instances, small, but we could wind up maybe not spending all of our grant funds if we weren't allowed to charge the salaries, because of course that's the bulk of our grants. Aspects of the program could be really difficult to monitor and enforce, and I'll just use the example that the new program includes time to go get the shot, and if you're sick from getting the shot, you can have family medical leave for that. We've had a lot of employees that have already been vaccinated. Even if we retro this back to April, which even if you choose to implement it, we're strongly hoping and advising you not to make it retro, to make it on a go-forward basis. And then different departments have different policies, I feel certain, on how they administer what employees do when they go take a vaccine. So there's just a lot of moving parts here that are costly in county time and effort.
And this only goes till September?
Yes, it ends in September. So it's a limited time frame. If we were still in the spike that we were in back in January when we were having $258,000 in wages for the pandemic leave, then the answer becomes very different. Today it's 38 and continuing to slightly decline based on like what Vinny stands here and tells you about the population as a whole. I'm not saying there isn't any COVID need for employees in our departments, but you've established pandemic leave, we still have sick leave, we still have a lot of options for those employees. So my recommendation today is that we monitor this on a monthly basis because you can implement May 1st, you could implement June 1st, you could any time before September 30th, you could implement it if it were to become a larger need and therefore larger credits. I've spoken with legal, HR, and budget. We're all, of course, open and willing to do whatever the court wishes, because it is your decision, and it is a voluntary decision. Staff, though, believes that right now, the dollar value of implementing the program combined with these costs and even some risk of liability to the county for not administering it fairly across the board, we are suggesting that we not take action today, and that we could monitor it and bring it back, and you could choose to take a different action on another day.
I would just say that I think I agree with what they did, because it is going to be a nightmare.
Yeah, I agree with you. There is enough money in the new program to reimburse us for all kinds of costs.
Yeah.
That we don't need to necessarily do this because it seems
It's going to be
more
inordinately hard to calculate and to really get into the complexities of it. And y'all are going to have more than enough to do already with the ARPA funds that are going to be coming our way.
Yeah, I mean, and I would add, if we are confident that we are already doing the most that we can to support our employees here in the county, and if this would actually add a burden, right, that we should just monitor it but not take any other action right now.
If you have any questions, please feel free to reach out to me, and I'll try to answer them at another time. Thank you.
Thank you, Renee. Anything else, Mr. Manius?
Yes, I have one additional agenda item.
Too bad.
Oh, I have an announcement.
You missed your
No, I
announcements.
did not.
We're past that point on the agenda. Go right ahead, Mr. Manius.
Yeah, no, please go, GK.
Members of the court, we could go to item number 2. We're requesting that the Commissioners Court approve a resolution supporting the extension of the district program to a minimum of September 30th, 2022. I believe you all have been briefed individually on this. The district program itself was part of 1115 Waiver. That was a 10-year waiver that the federal government approved in January. The current administration has rescinded that for technical reasons. The 1115 waiver actually expires September 2022. Unfortunately, the district program, though, expires on September 30th, 2021. And so we've crafted a policy statement as it relates to that. This has a significant impact to the state and to Tarrant County. We're talking about $300 million of programs or funding that go to the state. A substantial amount of that, probably more than $20 million, come to Tarrant County. It funds programs at the hospital district. MHMR receives a substantial amount of money from this program. And so what we're requesting that the court do unanimously is to approve the attached policy statement.
I will move for approval and just add that I specifically asked for us to develop this resolution because I think we have to do everything that we can to protect our current access for health care and then improve upon our future access. So again, with that, I move for approval.
I will second with the comment that ultimately we should be asking the governor and the legislature to expand Medicaid, and that would solve this entire problem.
We're not
We have
there
a
yet.
motion. We have a motion and a second. Any further discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you, Your Honor.
Thank you, sir. Looks like personnel agenda is coming up.
Move to receive and file personnel agenda.
Second?
We have a motion and a second to receive and file the personnel agenda. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Good morning.
Good morning.
Morning,
We
Robin.
have 3 more items for you. The first item I have is an approval of a waiver of terminal benefits for information technology. This would be effective May 1st, and this is a waiver for the lead customer support specialist. The overall net cost will be $22,839.89, as the individual that is leaving on April 30th has 400 hours of vacation.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Our next item is also a waiver of terminal benefits. This is for the Sheriff's Department, for the Chief Deputy of Warrants and Investigation to be effective May 1st. The individual in that position is leaving April 30th with 160 hours, and the cost to the general fund will be $12,864.05.
Move approval.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
And our final item is an out-of-class pay extension for the Sheriff's Department to be effective on, two different dates. On April the 20, to be extended through July 28th, beginning April the 30th, and the cost to this is $990.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Thank you, Robin. Mr. Vinnie?
So Public Health has two items for your consideration this morning. Number one, we talked about a little bit about this grant that we're getting from DSHS, so we're requesting your approval of the grant contract. I believe the amount is, go ahead.
Move approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you. And the second item is we're requesting approval of a COVID-19 master agreement between Tarrant County Public Health, the North Texas Regional Public Health Laboratory, and Abbott Rapid DX North America LLC for the purchase of reagents. This is for the Abbott ID Now test kits, the continued resupply of the reagents.
Move for approval.
Second.
We have a motion and a second. Any discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously.
Thank you.
Wendy? What did we find out?
We found out that Wendy was correct, but I'll read from the code.
What was the reason for waiving it, I guess is the...
There are two total items on this issue for this week, and it was failure to correct the mailing address by the appraisal district.
Both of them?
Yes, sir.
Move approval.
Second.
We have a motion and a second. Any further discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Thank you, Wendy.
Yes, sir.
Are there any appointments today?
I think I got one.
And I
It's
have
too late.
one.
Just like her announcement.
I've got, want to appoint Rebecca Barksdale to the Building Line Adjustment Board.
And I'd like to reappoint Jeanette Martinez to that same board.
Mine's a different board, but if you do it all together, doesn't matter. I would like to reappoint Pam Holland to the Tarrant County Historical Commission.
Okay, we have three appointments.
Move approval of all three.
That's what I was asking.
Can I make a quick comment?
Sure.
I had a meeting with the Historical Commission, new incoming chair, and they would appreciate any of your appointees who have not been appointed or who have not signed up to be reappointed, to please encourage them. They have a lot of active people, but they haven't been appointed because some of them haven't said, I want to be appointed. So,
Yeah, they've got to fill out.
and I'm as guilty. I think I got 4 vacancies. So,
So I know this will be the 4th person that's been reappointed. I think we're waiting to hear on the 5th, and then we have a vacant slot where I've asked for someone to serve.
Okay.
I think we're waiting to hear back from them. So, yeah, but thanks for bringing that up.
Was that in the motion, was that in the form of a second?
Daddy, yes, sir.
We have a motion and a second. Any further discussion? Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Court members, you have before you the claims, including the addendum.
Move approval of the claims, including the addendum.
Second.
We have a motion and a second to approve the claims, including the addendum. Please vote. Commissioner Johnson?
Yes.
Motion passes unanimously. Announcements?
Yes, this is just a reminder, today is the last day of early vote for the local elections and the special election. Polls are open from 7 a.m. to 7 a.m. to 7 p.m. And then, of course, Election Day is this Saturday. So please make sure that you go ahead and voice, make sure you vote in the election. That's it.
Thank you. Mr. Manius, briefing items.
Thank you, Your Honor. Members of the Court, we have two additional briefing items. The first one, which is item B. This is the legislative update. Mr. Schaffner has provided you with a memo concerning some of the activities that occurred last week and some of the things that are going to be considered this week. I'll touch on one or two of those. One of the things that we've been working on in Austin is the fact that there needed to be a budget amendment as it relates to local psychiatric beds in the JPS system. Representative Click has introduced a budget amendment that adds an additional $30 million in state funds for the purchase of those services through the JPS system. One that possibly could affect us, but since we do not issue any COs or certificates of obligation. House Bill 1869 creates a new definition for debt, and debt is now going to be defined, if this bill passes, debt that has been approved by the voters. That could either be GO or revenue bond debt. Historically have, a long time ago, we used to use COs. But through the budgeting process, we have eliminated that particular debt, and we do not use it. However, it is used by school districts. It's used by many different local jurisdictions, and that would mean that any payment of a CO would have to come out of the M&O rather than the INS rate. So that's one that we're watching. Senate Bill 1359 is the mental health leave. This is the benefit to law enforcement personnel. We're watching that very, very closely. One of the things that the court supported was the creation of a new criminal district court in Tarrant County. Senate Bill 1530 is the ominous courts bill, and we are included in that. Not only would it add a criminal district court to Tarrant County, but it would also designate, I guess that would be County Criminal Court number 6 as a family violence court. And then we already have spoken a little bit about the 1115 waiver and the DSREP. Members of the court, I'll be more than happy to try to answer any questions as it relates to that particular agenda item.
We got some information on census.
Yes, we sure did. And
was this I'm hearing in some news outlets that we're getting 3, and then but most congressmen, most are saying 2.
The Census Bureau had a news conference yesterday where they released the information. I believe that Texas is going to get 2 additional House seats. I know that California and New York have both lost a House seat. There's some other states that have gained and some others that have lost. Texas is going to pick up, it's my understanding, 2 additional House seats. Now, I do not know if the census has come down for Tarrant County yet. It probably hasn't. We normally get the state first, and then it comes down to us. Once we get to us, we're going to have a discussion in court about redistricting.
Well, and Russell sent a good recap email about the census numbers. I think it was yesterday.
Yeah.
Yeah.
Have we already contracted with bigger staff to discuss our redistricting?
We've not had any discussions with them at this point yet. We didn't know when the census was going to come out, and so, but that's our intent unless the court directs us differently.
Okay. Any questions? Thank you, Mr. Maynius.
So I want to give you an update as it relates to the transportation bond program. You might have received some information from us also. The only thing that we've included in your court communication today was just simply a copy again of the bond policy. There's a discussion in court as relates to how we might utilize consultants. And so when you take a look at the policy itself, it breaks down the $400 million into three different categories. You have $200 million, which are municipal projects, and that window to submit ended last Friday. I believe that we have 195 different submittals that we've received from 24 different jurisdictions. And the role of the PEC, the Program Evaluation Committee, was to look at those municipal submittals only. The second amount of money, which was $125 million, were what I would call multi-jurisdictional or regional projects. And the policy was very clear on that those would be the decision would be made by the Commissioners Court as a whole, and we'll be working through that process also. And then finally, the $75 million, which was divided equally amongst all the court members for your discretionary transportation projects. What we're going to recommend as it relates to the engagement of consultants is that we've had several meetings with the chair of the PEC. We've worked through this, and we're going to recommend that we engage a consultant, a sole consultant that will work in the PEC area. This is the municipal programs. And then we would engage a different consultant to assist the Commissioners Court in the $125 million multi-agency regional type programs. I believe that we need to have one consultant focus solely on the municipal programs because we have a very short time period to rank those. And so one consultant would be able to assist that committee in accomplishing that. As we move forward with the multi-jurisdictional and the regional projects, then we would engage a different consultant to assist the court in that particular area. If that is something that the Commissioners Court is okay with, then we would like to bring back a consulting contract solely for the municipal projects next week. We have Freeze and Nichols was the one that we initially looked at. We have renegotiated that contract, and the amount of money that was allocated for that contract, we have diminished that amount. We can provide additional funds whenever the court will engage a secondary consultant to help on the multi-jurisdictional and the regional projects. Also, I believe that you received a memorandum from Mr. Skinner from Transportation. We don't, the 195 is a large number of projects, and so there's going to be a need to probably have multiple meetings. We're going to engage in our initial meeting, the one that you as a court wanted to greet the PEC and just have a general conversation with them. That's going to be scheduled for May 11th, which is 2 weeks from today. We'll bring the PEC in here. You can have whatever comments that are we going to bring them? We'll work out the dynamics on how that happens. Then we're going to have meetings of the PEC on the 27th of May, June 24th, July 15th. I do believe that we're going to probably be going into August by the time we get all of those projects ranked. That'll still be plenty of time as we prepare for the bond program. Yesterday we did meet with General Counsel and the financial advisors, as it relates to the bond package and begun the process of structuring how the timeline and how the package needs to be put together. Once we get some greater clarity on that, we will be bringing that back to you. And so it was a good conversation yesterday. I believe that we're definitely on the right track on setting this bond, the call for the bond program. We'll meet all the legal requirements that are necessary. I'm also asking the FAA to basically run some different financial scenarios for us so that we can get a somewhat of a sense of how we're going to sell this debt once it's approved by the voters. We talked about a 10-year cycle to do that sale, but we'll just need to look at how the value is as far as increases in AV values and what monies that will allow us to utilize to issue debt. That is not unusual compared to what we did the last time. Mm-hmm. Yes, sir.
Question. Out of the 195 projects that were submitted, you kind of indicated that all 195 projects would fall into the $200 million silo. I question that, is that actually correct? There were no.
I'm sorry.
Did you not get any multi-jurisdictional projects also submitted, or are they lumped in with the 195?
The 195 was the totality of all the projects that were submitted. Have not gone through there and looked at the if there's any multi-jurisdictional. Okay. Obviously, we'll pick that out. But we have not begun the analysis of those 195.
Okay.
If it's a multi-jurisdictional, we're not going to reject it. Obviously, it's a policy of the Commissioner's Court, so that we would bring all of that back to you and ask for you to give us direction.
Okay. Oh, did you have more, Commissioner Fickus? Okay, because I had that same question. So thank you for that clarification. You'd mentioned a memo from Mr. Skinner. I don't think that
It's in the back of the, well, I'd say it was in the back. I don't know. It was part of the briefing on things.
If you did not receive it, I will send it back, resend it to all the court members. This is just a memo to the PEC that outlines the dates of the meetings.
Oh, this is what you sent out to the PEC. Okay, because I had a call last week with the Precinct 2 appointees, and they had mentioned that they had received communication. So thank you for making sure that happened. So then we're suggesting that this joint meeting of the court and the PEC is on May 11th.
Our recommendation is going to be May 11th, which is 2 weeks from today.
Okay. So it would happen in the afternoon, right? Because we have eGov that morning.
Yes, it would be after court. It was.
Okay, great. And then how did you say that will take place? So
that's still part of the discussion. We do not know if we're going to bring the PEC in here and then take them to the assembly room in the family law. Okay. But all the meetings will be at the family law for the work sessions with the PEC.
Okay, understood. Okay. And then the last thing, and we're talking about engaging 2 different groups of consultants, which I'd shared before that I was generally supportive of it, as long as, one, I want to make sure that it's my expectation that we will be thinking as big as we can with what's been submitted to us and then what we can do to benefit the county as a whole. And then secondly is that we are, as many points as we can, having a conversation about equity and how the projects, what the projects are, which ones get funded, all of that. So I'm generally supportive. I'm not saying how I'm going to vote on anything, but I will be looking for those things. So.
Okay. Yes, ma'am. If we could maybe have a discussion with you offline just a little bit so I could get some clarification.
Sure.
Okay, great.
That's all I have. Thank you.
Okay, on page 2, we talk about, under the call for projects A, that, that the cities or whoever doing this will provide at least 50%. we basically say cost overruns will not be funded in this category. Do we really want to say absolutely not, or do we want to at least have the discretion if we determine? Now, I don't know how we would do it. Maybe we do it by interest, maybe we do it by savings in other projects, but I hate for it to just be an absolute.
No, I don't think you want that. I don't think we want to say they won't be. I think there needs to be.
So I think you need to look at that and consider that. If we need to change this, if it was a vote of the court and we need to change it, then I think we need to change that. And then the other thing down under C, where we talk about countywide initiatives and partnerships, it almost implies that we're not going to ask the cities who are also a part of these projects to participate in those programs. And I would have expected that the cities, let's just take, we could take the Southeast Interchange, or we could take a number of those. And, I would say that if the county's portion, or the portion that needs to be paid for by somebody other than the state, that we at least ask them to consider.
So if, Your Honor, I understand what you're saying. Let me try to direct you. You see on page 3, before we get to item number 3.
Yep.
If you'll read that paragraph, it says the matching fund requirement for projects in this category will be determined by the Commissioner's Court on a case-by-case basis.
Well, I understand that, but it doesn't, again, up until that point in time, I believe all you've done is list, you've never mentioned a city. And so I would like somewhere in there to indicate that, oh, by the way, we could also require the cities along that route to also participate in there. Because I agree with what you're saying. It says the matching fund requirement, but all of the entities you list, well, wait a minute, there may be partnership projects to leverage funding for federal discretionary grant applications submitted by municipalities, TxDOT, and COG. So maybe that allows us to require the cities.
That's how I read it, but
Okay.
I get your point.
So the one good thing about this policy is that it's your policy, and it's subject to change. So as we go through this process, if we see a project that is a really good project, and it may not necessarily meet all of, not fit very handily in any one of these categories, then you as a Commissioner's Court have the absolute right to change this policy. And because all of these expenditures, and which will eventually initially start out as ILAs with the municipalities and everything, they will all come to you. And so what we're trying to do is give you the greatest flexibility.
And I appreciate it. I just don't want the cities to misinterpret the fact that on the big projects, we're going to do it and they don't have to be an equal partner in the deal. And that also deals, number 5, on page 5, the next to the last, right above bond election, that paragraph. If any project in the program experiences significant delays or funding problems, the Commissioner Court reserves the right to remove a project from this program, all the way up until the time that the programs or the project starts. Because I think once somebody starts a project, we're in it. And, we can't say, well, King's X, we were going to give you $10 million, but we've decided we're not going to give you $10 million. Because if I were a city, I'd say, well, then I have no guarantee that you're going to be in it. And once I've committed dollars, somebody's got to, we don't want a bridge to nowhere.
That's correct. But I think what we're trying to do, we experienced some things in the 2006 bond package where that a city started with the deal, with a project, and then they said, we're not going to move forward with this project anymore. We would rather put our monies in a different project.
And I don't have
And that's that.
Yeah, I don't have a problem as long as they haven't started the project we approved.
And of course, those decisions will come right back to you to make a decision at that time.
Yeah, we have a project in Grapevine, $12 million on Iowa Woods, that we were gonna put half, city was gonna put half, and then all of a sudden, 12 million in stimulus funds became available to the state. They went looking for a shovel-ready project. That was it. That money went there. We got to take our 6 million, put it on 26 in
Right.
Colville, and back on a Bass Pro Drive.
And I don't have a problem with that, but if the Grapevine had started the 6 million and we didn't get
Right.
anything, I don't think we start a project and then say, we have the ability to say King's X. Okay, thank y'all. I think that's good work, and I'm looking forward to the meeting on the 11th, to have an opportunity to talk with our committee.
That's all we have at this time, Your Honor.
Then we will recess our open meeting, proceed to close to discuss items exempt under section 551.07, 1072, 074, 076, and 087 of the Texas Government Code. Having returned from are you there? Blink at us.
Up there, you're there.
Having returned from our closed session, there being no business to conduct at this time, we stand adjourned.